Hi, everyone. Hi. Thank you so much for coming today. It's great to see you all here. This topic is going to be essentially ABA 101. It's a topic that I have a true passion for, and I am very excited to get to share a little bit more insight with all of you. Um, I call this presentation a roadmap through the world of applied behavior analysis. So please just think of me as your tour guide, this presentation. A little bit more information about me. My name is Ian Gentile. I am a board certified behavior analyst. I have been within the world of ABA for about 11 years now. I completed my undergraduate education at Bowling Green State University with degrees in psychology and criminal justice. After graduating from Bowling Green, it was actually my first step into the world of ABA, and I really discovered a true love for applied behavior analysis. And it's really kind of driven my passion for it these last 11 years. Um, After dipping that toe in, I went on to pursue my graduate degree in applied behavior analysis and became a board certified behavior analyst. Currently, I work with Illuminate ABA here in the Cleveland area, but I do have experience working in all sorts of a variety of settings, including schools, homes, hospitals, the community. And I think that's just a true testament to how diverse the field of ABA can be and how many different situations ABA can help address within patients' lives. Okay, so what is applied behavior analysis? Applied behavior analysis, most commonly referred to as ABA, is a scientific discipline. We are committed within the world of ABA to understanding of human behavior and the improvement of that human behavior. Um, ABA is truly different from other disciplines within the mental health realm. Um, we are focused on the treatment of behaviors of social significance. But what does a behavior of social significance mean? Um, it is any behavior that impacts the quality of life of the individual patient. Behavior such as learning the proper steps to dressing, learning our letters, and it can even focus on behaviors that cause harm and cause an impact to day life. This is just a small sample of all of the behaviors that ABA could potentially help address with the individual child's life. What is a behavior analyst or a BCBA? Behavior analyst is a dedicated clinician um, dedicated to the improvement of an individual patient's life. We use the scientific approach of ABA to help develop systematic methods to produce a change in the identified behaviors of concern. A BCBA, it's important to note, is a dedicated clinician. A BCBA will always consult with the individual family and the individual patient's caregivers to design a dedicated treatment plan that's unique to the individual and unique to the individual's circumstances. A BCBA adheres to high ethical standards to design a treatment that is really dedicated to the improvement of the individual patient's life. We will never introduce a course of treatment with your individual child that you do not fully understand or are in agreement with. And what's nice is the plans are always developed in conjunction with you. So if at any time during the course of treatment you do become uncomfortable, that's completely fine. It's just a conversation with your dedicated clinician to figure out another method that will work best for you. In addition, a BCBA is responsible for all of the therapeutic interventions that will be conducted with your child. We are also responsible for giving you, the family, the individual tools that you'll need so that when we're not there, you guys will be able to carry out some of these interventions and some of these systems that will truly impact the quality of life of the child. So, our first pitch stop of the day, what does this all mean? This all means that your BCBA, your dedicated clinician, will study the setting and all its variables in great detail. We are going to be concerned about the things that are happening around the patient, about the things that the patient has experienced, and all of the different interactions that that child may have throughout their day-to-day life. Your BCBA is going to use evidence-based assessment tools and methods to determine the factor that is causing the behavior of concern. This is known in the world of ABA as the function of behavior, but please just think of that as motivation. What is motivating those behaviors to occur? This can be anything from the setting that the child is in. It can be interactions that the child has had throughout their day-to-day lives. It can be everything from noises that might be around the patient to things that the patient is desiring and wants and might just not have that ability in that moment to appropriately communicate that they want or need that thing. All of these factors will be considered by your BCBA, your dedicated clinician, to figure out the most effective, appropriate way to help the patient address their needs. Now, there are strong differences between ABA and psychology. The main difference is that ABA is focused on the observable behavior, not what the patient may be thinking. This allows ABA therapy to be used in a large variety of settings, such as within homes, schools, community, hospitals, really anywhere that you can imagine a dedicated clinician can provide ABA treatment. A funny little antecedent to that is at one point in my career, I was actually on a flight helping transport a patient back home to their family, and at 30,000 feet in the air was doing some ABA techniques to help that patient make it successfully through that flight. So it is truly a really diverse field with a lot of great systems and tools that can help, again, improve the overall quality of the individual child's life. Um, the reason that ABA is able to accomplish such positive outcomes for patients is because our system of study and our methodology is firmly rooted in scientific principles. We have a dedicated foundation of empirically and evidence-based treatments that have been proven over the decades to produce high quality outcomes in the lives of our patients that we serve. So for our next pit stop, I really wanted to talk about some of the things that ABA is not. Um, It is just a fact that within the world of ABA, there are some misperceptions of what ABA is. And I want to stress that this is not an inclusive list, but it is a list of some of the top things that we hear the most when it comes to ABA. So to start off, ABA is not bribery. The therapies that we provide, the treatments that we seek to implement, are not rooted in bribery. Rather, we are seeking to really understand those fundamental tenets of what is causing a behavior and designing systems that will help improve and replace that problem behavior with a more socially appropriate alternative. We do this by reinforcing that appropriate behavior. We are seeking to eliminate those behaviors that are truly impacting not only the quality of life of the patient, but of the patient's family, of those individuals that they might interact with. And the goal is to really improve everything that goes into that patient's day-to-day life. Um, Again, the focus, and this is how we differ from psychology again, is not on changing the patient's thought. I really like to stress this because, as I'm sure you all know because you're here, each person is an individual. And ABA never wants to change all the wonderful things that goes into making up that individual patient, from their personality to the things that they think, to the way that they express themselves. That is not the goal of ABA. We do not want to change all the unique and wonderful things that go into making a child a child. Rather, we are just seeking to give that individual patient better tools to help them navigate their day-to-day lives. This can really help the patient feel successful and more motivated, and just make things overall easier for that individual child. And at the end of the day, that's truly the ultimate goal of ABA. ABA is not counseling therapy. So it's not traditional talk therapy. We're not just sitting there and trying to analyze the individual child's feelings and essentially talk things through. We are looking to put very adequate systems into place that can give, again, that individual child the tools that they need to navigate successfully their day-to-day lives. Another one that I hear a lot is that ABA is essentially animal training. Um, this one is actually based a little bit, has a little kernel of truth to it, where ABA principles are used when training animals, but that is not what ABA is designed for. It is just a fact that ABA can be used when it comes to animal training, but it's designed that way because of the principles that it uses is rooted in that systematic method of empirically based evidence. Rest assured, ABA is used all throughout the world, from businesses to schools in hospital settings. And again, it is designed that way because it has such a long track record of producing tangible improvements to the quality of life of children and patients. Um, ABA is also not solely used with autistic individuals or autistic patients. The principles of ABA are used every day to help improve the lives of patients with a host of neurological and developmental disorders, as well as those neurotypical individuals. Again, it can be used in businesses and hospital settings. It can be used in schools. And that, again, goes back to that foundation of having it based in a science of empirically based, evidence-based interventions. So how does ABA help the patient learn new skills? This is a great question. And it is truly, again, based on those scientific principles. If you decide that working with a BCBA to provide ABA therapy is right for you, you can ask your BCBA to work on teaching new skills and focusing on decreasing behaviors of concern. Your BCBA will, before any treatment is offered or implemented or even suggested, will have a full range of meetings with you. Those meetings are dedicated to determining what behaviors and what areas of skill development are truly important to you and your family. Um, what's nice about ABA is that those concerns are always the most key factor in ABA treatment. We never want to put into place a treatment, therapy, intervention that is not relevant to the lives of your child and your family. This goes back to also that consistent communication your clinician will have with you throughout the course of treatment. Because it's just a fact that things change. Our children grow, our patients learn new things, our patients experience new things. So our treatment is always a working document. We are always going to be in constant communication with you all to design the course of treatment that is most effective for your family. Um, a BCBA will also never provide any course of treatment that you are not comfortable with or are not completely in lockstep with. Um, we will never suggest you go out and buy things. We will never suggest that you start seeing another provider. We will always develop in adherence to those high ethical standards and to the system of scientific development of ABA. We will always make sure that the things that we are recommending are what's best for you and your families. What makes ABA an effective treatment option? There are a number of key components that make ABA effective, but at its core, the science of ABA is effective because its very foundation is again built upon that scientific research. This research has again been conducted for decades in various settings, from laboratories to clinics to schools to hospitals to community settings. It is truly has a decades wide span of proven effective courses of treatment. Um, all techniques and teaching strategies used in ABA are thoroughly grounded, again, in that evidence-based research. But what does that mean? This essentially means that every single strategy that we recommend, intervention that we would put into place, has a thorough track record of not only being studied, but being implemented with success. Um, in addition, a core component of all ABA therapy is the development of individualized treatment plan. And when we say individualized treatment plan, we truly mean this. We take the approach that every individual that we treat is truly unique, that has different experiences, that has had different things happen to them in their lives. All of those various variables go into the design of that individual patient's treatment plan. There is no one size fits all approach to ABA treatment. And it is this core tenet that truly allows for some of these amazing outcomes to happen within the world of applied behavior analysis. But what are some of the things that a BCBA can truly work on with a patient? This is a very great question because it truly speaks to the diversity of interventions within the realm of ABA. Yes, ABA is primarily designed to help address some of those maladaptive behaviors or some of those behaviors that could cause harm or interfere in a patient's day-to-day life. These are things such as physical aggression, tantrums, self-injury, but ABA is not just limited to addressing those behaviors of concern to teach an appropriate replacement behavior or a method of communication. ABA can truly help learn new skills as well. These can be in the category of, let me see if I can get my laser pointer to work here. Most common skill sets. So motor skills, this is items ranging from walking to even holding a utensil to help the child or the patient through meal times more effectively. Functional skills, this is anything ranging from potty training to learning to dress to cook to how to use money. Um, Communication skills is a big one. I work with patients every day working on new methods of communication. This can be all the way from improving vocal speech to learning those alternative methods of communication. You might hear the use of terms like picture exchange, which is essentially identifying a method of communication that uses pictures of items or activities to properly express a want or a need. We can also help with sign language and really everything that goes into learning how to get the individual patient's individual wants and needs across. Social skills is another big area of development. A lot goes into social skills. This can be ranging everywhere from learning to just establish a relationship with another peer or another adult towards maintaining that relationship. Everything that goes into that, from learning to share or learning to take turns, all of these things ABA has therapies in place that can help address. And then finally, academic skills. This ranges again all the way from letter identification to learning how to read and how to then incorporate that into some of those new communication skills. Um, the main position that I'm really trying to drive here is that ABA can help with so many new skill developments within an individual patient's life. And again, that will be the job of your dedicated clinician, your BCBA, to work closely with you to determine what are the areas of skill development that will best help your family. Is ABA ethical? Again, this is a great question. In short, ABA is absolutely ethical. ABA therapy has been proven over decades to be both ethical, safe, and an effective treatment option. We are truly set up to promote learning in a wide variety of skill areas. Again, our primary mission is to provide maximum benefit. Oops, clicked off that. To the individual by providing therapy such as positive reinforcement. Again, that goes back to that bribery component that we were talking about earlier. We are not seeking to bribe the patients into better behavior, but rather we are systematically identifying all the variables that will produce a positive change in behavior. And then using these proven evidence-based systems, we are going to reinforce that positive behavior change. We are then going to make sure that we're working again with all of you in the family to make sure that you have a true understanding of all those things that we've been teaching your child in order for you to be able to replicate those things within the home or really anywhere that you might go throughout your day-to-day lives. It's also, I like to really note that um, your dedicated clinician, your board certified behavior analyst or BCBA follows a strict ethics code. This ethics code will be provided to you by your clinician at the start of any treatment that they might do with your child. But the important takeaway from this is that it lays out high responsibilities of professional conduct for the clinician and anyone that the clinician might be interacting with throughout the course of treatment. Um, we adhere to this code religiously and will always make sure that we are first doing no harm to the patient or the patient's family. And it puts a lot, this ethics code also puts a lot of control into your hands as well, because again, you will be in almost constant communication with your dedicated clinician. So nothing will be implemented without your strict approval and understanding. And if at anytime you are uncomfortable with anything or don't understand something your clinician is talking about, it is then on that clinician to either provide that understanding to you or provide recommendations for different treatment interventions or options. But it is always a consistent line of communication between you and your clinician. That wraps up my little roadmap through ABA. I would be happy to take any questions that you all might have right now and I can help address. Yep, right there. Yeah. Yes. Mhm. Yes. Mhm. Mhm. For sure. For sure. Thank you so much for your question. That's a really important point and question. Um, Within the world of ABA, individual goals are broken up into both short-term and long-term goals. This is so that we might be able to make sure that our each of our individual patients has really achievable outcomes, is not overwhelmed by any one thing, and we can take that good data on each of the steps in order to determine the most effective course of treatment. So a good example of this is if we were looking at, say, washing our hands. I wouldn't throw every single step of that process at the individual child all at once, because that would just be super overwhelming and confusing, and we might not truly know what one system we put into place produced a behavior change. So our long-term goal would be we want to be able to complete each step of the hand washing process. We want to be able to wash our hands independently. But our short-term goals might be, let's just start with step one of learning how to turn on the water. How are we going to teach to turn on the water? We might dive into systems of communication. We might incorporate visual supports into that, or if we have some maladaptive behavior around washing our hands, put into place systems of behavior supports to help the patient learn just that first step. So our short-term goals will each be broken down so that we can truly teach individual steps. And then over the course of time, we can see all of that good data that we collected on the effectiveness of each of these interventions. And we can chart out through the use of graphs and other data collection methods to determine, is our program effective, or do we need to put into place a different intervention in order to help us reach our ultimate long-term goal of being able to independently wash our hands. Any other questions? Yeah. Right. Hi. Yeah, absolutely. Uh-huh. Hmm. Mhm. Yes. Uh-huh. Mm-hmm. 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 Yes. Mm-hmm. Yeah. Yeah, absolutely. Well, yep, absolutely. Uh, Absolutely. Absolutely. So I will do my best to try to put you a little bit more at ease. Um, I think this kind of speaks to the importance of kind of finding the right ABA provider for you, to finding a truly dedicated clinician that is really views their role as more of an advocate, not just for the child, but for the family as a whole. And being able to start from that place will hopefully be able to make all these other concerns of yours much more conquerable. Um, by what I mean by that is that finding that good and ethical ABA provider and dedicated clinician, it's then their job to make sure that they're listening to your needs, that they are taking into all of the factors that you experience throughout your day-to-day life. And that truly comes down to both talking to other providers that are in your child's life, so talking to the school, talking to any occupational therapists or any other specialties that you might be encountering throughout the course of treatment for your child. But it also is making sure that on our end, we are not overwhelming your child with treatment, because there is such a thing as too much treatment. So part of a good intake process for your child is identifying all those other things that the child is doing, whether it's school, sports activities, family time. We always want to make sure, again, that we're not being aversive or overwhelming, that because good ABA treatment at its core takes into account all those things. We want a well-rounded child, and we want the child to be able to have lives outside of treatment. All a all good ABA treatment is trying to do is give that child more tools to live a successful life. So I use all that to illustrate that a solid clinician will always take those variables into account and will not make treatment recommendations hours wise that are unreasonable. And if you do encounter a clinician making those recommendations, I would just recommend drilling down a little bit more on where those recommendations are coming from, and be able to seek out the information on, are there other things that we can do to limit some of those hours so that they can experience all those different things that go into living a well-rounded life. Oh, yeah, right back. Uh-huh. Uh-huh. Yes. Yes. Yep. Yep. And that's a good point. I always like to make the point to the families that I work with that really any amount of hours, if your child can benefit from ABA. So there are a world of things that a BCBA can do and design to make even 1 hour, 2 hours an effective course of treatment. But just having that conversation with your provider and making that clear, I promise you that a dedicated BCBA will always take those concerns into account. Yep, yep, right here. Mhm. 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 Yeah. Uh-huh. Yeah. Mhm. Yeah. Yes. Mhm. Mhm. Yep. And you can request that as part of your individualized education plan as well. Another recommendation that I would make when you do make that request is that you guys outline a timeline of when that school-based BCBA is going to be checking in on your child throughout the school day to make sure that you guys have consistent observations for that BCBA to be able to monitor the effectiveness of all of the interventions that they're recommending for the school. I like to bring that up because it's sometimes, I'm not sure what school district you're in, but it can just be a resource issue sometimes, and you want to make sure that the treatment that's being recommended, that that dedicated clinician has adequate ability to be able to monitor the effectiveness of all of the programs that are being implemented. In addition to that, if you in addition to receiving a school-based BCBA, if you conduct ABA treatment outside of the school, just following up with your private clinician that you make sure that you're communicating you would like them to also coordinate with the school-based team and really any other specialist that might be seeing your child because a BCBA has that ability. And I truly believe it's an important fact of ABA treatment to make sure that everyone is essentially on the same page. Yep. Yeah. Mhm. Uh-huh. There, yeah, I would say there are certainly some misconceptions about ABA out there. And there are certainly, and it only helps to be honest about it, there are certainly some families that have not received the best quality of ABA treatment. And just the world we live in, sometimes those misconceptions get amplified. But I really want to stress to you that um, what I presented on today is everything that ABA is designed and can be. So I don't want to say like it's all on you as mom to, but just really do your due diligence. And ABA is making true improvement each and every year, and there is no limit to what a board certified behavior analyst and an ethical ABA provider can help with you and your child. Mhm. Yeah, right there. Hmm. 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 Yep. Yeah. Yep.
That's like, if you're just forcing a kid to put a fork in their hand and making them do it, just for the sake of having them put a fork in their hand, I don't know how much it's going to last as much unless they're really walking through the steps of why these things.
Yeah. Absolutely. And thank you so much for sharing all of your thoughts on that. I definitely appreciate it. Um, to address your question about the ethics slide, that was really just included to address some of the misconceptions and the history of ABA, to provide a really answer for why some of those things exist. Um, to your point about changing thoughts versus changing behavior, ABA is really, again, just trying to give the individual child more tools and more ability to communicate what their wants and needs and problems are. We never want to force a child, for example, to hold a utensil just for holding a utensil's sake. We just want to teach them have the ability to make having a meal easier and more effective. Um, yes. Hmm. Hmm.
But why is it so popular that it's not as big? Is it because
Uh-huh.
every day
Uh-huh.
they're not? Why?
Yes, and with some of it depends, again, it's very individualized. It depends on what the individual diagnosis is for your child versus another child. But those systems are designed, again, to provide better tools to address some of the sensory issues that they might be experiencing that might be causing those behaviors. And until we can directly see the day-to-day interactions that the patient is experiencing, we might not know why those behaviors are occurring or why this skill is an area of struggle. We are simply at our core just trying to make that individual patient's life and experience a bit easier. So for example, if eating time is a real struggle, that might very well be because the noise of the refrigerator is really bothering us. So if we can figure out a way to kind of negate some of those environmental factors, that might produce a lot more less stress in the individual patient's experience, and those times might not be as much of a struggle. Yep. Yep. Hmm.
Therapist's office, and within 15 minutes, she said, "Oh, Kennedy is on the too." Left the office, we were like, "What?" So
Uh-huh.
I was really mad, and I worked with the all them, and even now, when she didn't get the test or anything, like, we're fine if she's autistic, but
Mhm.
we just thought that we never would have done the genetic testing to find out something deeper if it wasn't for her. Great.
Yeah.
Now, she called and like got that doctor probably in trouble, but now 2.5 years later, I'm like, okay, you get ADA, I need that autism diagnosis, and it is under my chart, I guess, so you can use it. But like, what if people don't have the autism diagnosis from that doctor?
Yeah.
Like, how to get the services provided for you?
So you are correct that it's generally easier to get ABA treatment with an autism diagnosis. That there's a lot that goes into that. That's primarily more of in the way that the insurance system is set up versus um, yes and no. Yeah.
Say, yes, too. Basically, somebody said to me, you're gonna give insurance, your diagnosis, and the PCA comes to your house, you're gonna see really like the village.
So yeah.
Whether they pay insurance or privately, whatever it is, there's also an option at school, like that have a secondary office.
Mhm.
That right. Precedent on what treatment. So, thrown out district and through the no art.
Mhm. Yeah.
People don't wanna have to
It's
pay
not
for
that-
somebody to
it's
come to the
not.
house for 8 hours.
Yeah, like it doesn't get any better here.
But
But
like,
we ever keep it. So the school or the district behavioral analysis did a positive behavior test that they went to class.
Yeah.
They saw, instead of using the word aggressive, I forget what word we used, but it was physical refusal, instead of aggressive. So we changed the wording on that, but they saw him say like pulling students together. So for him, it was the social standing of, well, how can we interact with our friends? How can we share with our friends without being aggressive in a way of like putting them off? So they take the data,
Mhm.
part it out, and then how we flip it to see how we can better communicate with our
but like,
Yeah.
if people want it outside of school, you don't want to pay for a clinician to come to your house for 8 hours a day. But I'm saying, well, I've been told a million times I've asked to be diagnosis, so. If that's- But like.
Yeah.
that's-
Well, uh-huh. Uh-huh.
Proud that have autism or a second diagnosis, sometimes it's insurance perspective.
Mhm.
So, yeah, my singer rep said it has to have autism.
Yeah, I'm sorry. I can't really speak to like the individualities. Yes, to answer your question, one of the great things about ABA is that we have a proven track record of helping patients across diagnoses. And oftentimes the patients that I work with have multiple diagnoses that we're using ABA treatment with. So a quick example of that is I've worked with individuals with autism, with Down syndrome. I've had one patient with SATB2. Um, in addition, the list is really kind of exhaustive, but a good point that with that is that ABA can really be used in conjunction with a lot of these other therapies to produce. Uh, I'm not, yeah, yeah, yes, go ahead. Uh, yes. Yeah. Hey, you're welcome. Okay, I'm happy. Thank you. Okay.